Hi everyone, I'm Dr. Sivasubramaniam, consultant medical oncologist and radiation oncologist at Sundaram Medical Foundation, Anna Nagar. Next is head and neck cancer. Head and neck cancer includes oral cancers, throat cancer, or it can be a laryngeal cancer, or it can be a oropharyngeal cancer. So why it occurs means because of tobacco chewing habit or smoking. Whenever combined with alcoholism, the chance increases. So what everybody should be alert about is any non-healing ulcer in the tongue or buccal mucosa they should see. So any ulcer in oral cavity should heal by itself in 2 weeks or maximum by 4 weeks. If an ulcer is not healing by itself, it can be a malignant ulcer, especially when the individual is having the habit of tobacco chewing or smoking. The other common symptoms are if they have a ulcer or growth in larynx, they may have a laryngeal cancer, that is throat cancer, or patient can have a pain during swallowing, that is called as odinophagia, or difficulty in swallowing, that can be called as dysphagia. If that is the symptom, patient can have a oropharyngeal cancer or a laryngeal cancer. So next is esophageal cancer. Esophagus is food pipe. So whatever we eat by mouth, it goes inside stomach through this esophagus. Most common and most important symptom is dysphagia. Dysphagia means difficulty in swallowing. It can be either difficulty in swallowing to solid food, that is difficulty in eating idli, dosa and all those things, or it can be any difficulty in swallowing semi-solids like kanji or milk or anything like that. Or sometimes if the disease is very advanced, they may have dysphagia to water also. So any dysphagia, any amount, it should be addressed immediately. But common thing which we will confuse is any throat infection or pharyngitis can cause dysphagia, but it will resolve within 10 to 15 days. But this dysphagia, it will persist for months together. We should immediately check for the cause. Otherwise, it is also a very, very bad malignancy. Easily it will be inoperable or it will spread to liver. The moment it is inoperable or it has spread to liver, the prognosis is very bad. So any dysphagia lasting more than 2 weeks or 10 days, it should be checked what is the cause. Then we have to evaluate properly. Next is stomach cancer. Stomach cancer incidence has increased a lot in India as well as worldwide, especially in Chennai and metropolitan cities. The incidence of stomach cancer has increased a lot. So it's a very, very difficult to diagnose stomach cancer in the early stage because most of the time the symptoms are attributed to normal gastritis or dyspepsia, anything like that. But if we neglect the symptoms and keep going for months together, we may miss the bus. So anything abnormal, that is indigestion problem or dyspepsia, or they have a belching problem, or if they have any stomach ache, especially if they have a habit of smoking and alcoholism, it should be get tested. That is the first most important and definitive modality of investigation is endoscopy. So they will put a camera into our stomach and see what is there. So we should not be afraid of these tests because it will help you in saving the life, because it is very, very difficult to diagnose stomach cancer in the early stage, that is stage 1. Most of the times all the symptoms or the general practitioners attribute any kind of stomach cancer symptoms to a normal pathology, that is gastritis or GE or the gastroesophageal reflux disease, or it could be any ulcer or dyspepsia, all those things. Next is colorectal cancer. The most common symptom of colorectal cancer is altered bowel habits. What does that means? Everybody will have their own bowel habit, that is usually passing motion once or twice per day. If there is any deviation from this normal habit, for example, if a person goes for toilet 3-4 times per day, the moment he eats food, he wants to evacuate, or if he is facing constipation problem in a continuous manner, that is once in a while everybody can get this problem, or if it goes for months together, it can be a manifestation of colon cancer or rectal cancer. That means, which is called as altered bowel habits, that is any change from the normal bowel habit. The other common symptom we encounter is any blood in stools. It can be fresh blood or stool mixed with blood, or after motion the person can pass blood. It can be any manifestation. The next common symptom is mucus in stools, that is any mucus discharge in stools. That can also be a manifestation of colon cancer. And very rarely patient can have severe anemia, especially in old age. So old age anemia, always we have to keep in mind, it can be a colon cancer. It can be a very rare manifestation, but we have to think about. Thank you everyone. What I would like to stress is we should not wait for pain. So cancer is always painless. Only in terminal stage cancer will be painful. So we should not think that cancer will be painful and wait for pain to occur. The moment we see something abnormal, we should get tested, and thereby we can diagnose the disease in stage 1, 2 or maximum 3, because the lesser the stage, the more the chance of cure. Thank you very much for listening.